So I'm an associate professor at the University of Colorado College of Nursing and the specialty director of the Psychiatric-Mental Health Nurse Practitioner Program. And so I teach in the Psychiatric Nurse Practitioner Program as well as our graduate and DNP programs. Some of the kind of innovative things I have done with my teaching is really our psychiatric simulations program, as well as some of the teaching modules that we've developed to address stress and burnout in nursing, which we know is a major problem. And so we've developed some modules and experiential learning activities to really help students across all programs, both undergraduate and graduate programs, to be able to get more content and education around multiple mental health topics and stress and burnout. We have done lots of different work around kind of building resiliency for nursing students as they're preparing for their career. In addition to the modules and the educational content we developed, we also created brand new simulations and virtual simulations that the students would participate in to utilize some of the skills that they've been learning from the modules. So for example, with the violence prevention and intervention, we created a virtual scenario where the students would get to interact with a patient's family member that was really escalated, and then depending on how they're talking to the patient or responding to it, she would either get even more agitated or they could de-escalate her based on what they're actually saying to the patient. So it was pretty cool to be part of that team to help develop these new virtual simulations and see how those can help with student learning and practicing some of these important skills in a safe environment before they get out to the clinical setting and really needing to face many of these challenges head on. In terms of my research and scholarship is also in line with my clinical practice around violence prevention and intervention. So I've been doing a lot around intimate partner violence prevention and understanding what are some of the best ways that not only can we prevent it from occurring, but how do we intervene? And I'm currently working on quite a bit of research with forensic nursing team, where we're looking at people who come through the emergency departments after they've experienced various types of violence or sexual assaults, and being able to see the trends and then what we can do to best address the needs of those patients, and especially from the mental health implication side of things.